You can run 10 kilometers every morning. You can eat healthy food, stay lean, and never miss a workout. You can feel stronger than everyone around you, while a deadly blockage is silently growing inside your heart. That sounds impossible, right? But biology does not care how athletic you look on the outside. Your body is incredibly good at adapting. In fact, it can hide a dangerous blockage for years without giving you a single warning sign. And that is why, for millions of people, the first symptom of heart disease is not chest pain. It is sudden death. In this video, we are going to uncover the shocking reason healthy hearts suddenly fail. You will learn how arteries become blocked, why symptoms stay hidden for so long, what actually triggers a heart attack, and the modern scans doctors use to detect hidden danger before it is too late. By the end of this video, you will understand one important truth. Feeling healthy does not always mean your heart is safe. To understand why the heart can suddenly fail, we first need to understand how the heart survives in the first place. Your heart is a muscle, and like every muscle in your body, it needs oxygen to stay alive. But the heart has a problem. Unlike your arm or your legs, the heart never rests. It beats every second of every day from the moment you are born until the moment you die. Because of that non-stop workload, it demands enormous amounts of oxygen-rich blood. To supply that oxygen, the heart relies on a network of blood vessels wrapped around its surface called the coronary arteries. Think of these arteries like the roots of a giant tree. If a tiny root is damaged, maybe only one branch suffers. But if the main root is cut off, the entire tree can collapse. Inside the heart, there are two major coronary arteries: the right coronary artery and the left coronary artery. The left artery branches into one of the most important vessels in the human body, the left anterior descending artery, also known as the LAD. Doctors have another name for it, the Widowmaker, because when this artery becomes blocked, it cuts off blood flow to the heart's main pumping chamber, the left ventricle. And if the left ventricle cannot pump blood to the body, survival becomes nearly impossible. But here is the terrifying part. This deadly blockage can grow silently for decades while you continue living a completely normal life. You can still jog, still work out, still feel strong. So how does something so dangerous remain invisible? The answer lies inside the walls of the artery itself. A healthy artery is smooth, flexible, and elastic. Imagine a brand new rubber hose with perfectly clean inner walls. Blood flows through it effortlessly. The inside lining of the artery is called the tunica intima. Under healthy conditions, this surface is smooth like glass. But over time, life slowly damages this lining. High blood pressure creates mechanical stress. High blood sugar triggers inflammation. Smoking releases toxic chemicals into the bloodstream. Even years of intense physical stress can create microscopic injuries inside the artery wall. These tiny injuries are where the danger begins. Your body immediately tries to repair the damage. It sends LDL cholesterol to the injured area, almost like construction material patching a crack in the road. Then immune cells arrive to clean up the area. But instead of fixing the problem, these cells absorb cholesterol and transform into what doctors call foam cells. Over time, these foam cells harden into plaque. This plaque is made of cholesterol, calcium, dead cells, and inflammatory material. The process is called atherosclerosis. Now, here is where most people misunderstand heart disease. People imagine plaque like hair clogging a drain pipe. They think the artery slowly narrows until blood can no longer pass through. But that is not how it works. The human body adapts. As plaque grows, the artery wall often stretches outward to preserve blood flow. This process is called positive remodeling. And this is exactly why someone can have severe heart disease while still feeling completely healthy. Blood is still moving. Oxygen is still getting through. The heart keeps functioning normally, until one day, it suddenly doesn't.